Hi everyone, I'm Dr. Justin Lin here at Rehab and Revive Physical Therapy, where we rehab your mind to revive your body. Today I'm excited to bring another pelvic floor therapy exercise that's useful, especially for those of you who just aren't aware of how to even get a Kegel or a Kegel, whatever you want to call it. Kegel.
They're called bagels.
I lived in New York, Troy. I know what a bagel is.
What the hell is wrong with you?
I just saw Kegel, and how to use it correctly and how to get things jump started. So we call this pelvic floor hip rolling. So stay tuned and we'll show you how to do it safely. Why is pelvic floor therapy important? I think everyone needs it, number one. And of course, it's worth getting and doing some of these exercises because pelvic floor is like the hammock. It's a support to our system, our abdominal, our visceral, our organ system, and it really keeps things moving, gets our core muscles. And of course, you've heard a lot about pelvic floor therapy and yoga and whatnot. And those are important because it helps sexual function. And it also helps things like eliminating or defecating. So make sure you get these muscles warmed up, because some people actually live with a lot of dysfunction. So this is important, and we take this stuff seriously. And if you need a pelvic floor therapist, go check one out. Find a good one locally near you. And if you're in the Orange County area, we have Dr. Wong here at Rehab and Revive, and she's a great therapist to help you. So stay tuned. We'll talk about hip rolling. So let's get into the nuts and bolts of hip rolling, or pelvic floor hip rolling. What we want to do is, interesting enough, is we want to internally rotate or just rotate inside, and then we want to rotate outside. So it's internally rotate, externally rotate. We're trying to teach our pelvic floor to chill out. Chill the F out. So we need to chill it out. So we want to go in and then we got to go out. Now the cool thing, what a lot of people don't know, the cool biomechanics of this is when you can learn to internally rotate your hips, your pelvis actually stretches like this. And that helps you with a very important key function called push off in the way you walk. Everyone knows how I love talking about walking. So when you got internal hip rotation, you are now unlocking the ability to push your legs back without hurting your poor spine. So that's the key. But we're talking about pelvic floor right now, so that's what we're going to get into. I just want to give you guys a little side note, little teaser. So right over here, so it's going to look like this, and I'm just super relaxed. I'm just going to, you could either do one leg or you could do both legs. I like to start with both legs. But if you happen to have a really tight side, your pelvic floor therapist can confirm that. Let's say it's my left side. Generally, everything's wrong on my left side for those of you who follow my videos. What I really want to do is be able to get this one side. You can see I can't rotate this as much as I rotate this. So, I can really try to just rock it in, rock it out. Sometimes there's so much pain, especially a lot of the ladies who've just pushed out a baby and some ripping occurs. That's going to be the key to just get things starting to warm up, re-educated again. Because a lot of things, for those of you who've had issues after babies, like eliminating or defecating, there's a lot of problems, and these muscles are weak and they're in shock, and you want to just really avoid that. Take a look here. Now it should be a little bit more even, and I can tell you that everything's kind of just dropping the right way. The muscles are just relaxing. They're not so clenched. So make sure we're just relaxing and chilling everything out. And this is like easy. I could fall asleep doing this, I guess, and just pass out. But get this going, get this relaxed, get the muscles, their ability to flex and extend and really open that up and gain that function back. Stay tuned. We'll be right back. All right, that was a great little exercise, get things warmed up. Fortunately, I'm not in acute pain like we mentioned before, but it's a great little warm up or segue to getting those muscles warmed up down there and get things moving and functional. I think it's important for everyone, men or women, to get this worked on and get these muscles functional again. And it's really important, especially some of you post-baby women that had some occurrence or incidences during labor. This is great to kind of get these things calm down the nerves and the healing, get the healing process going. So make sure you check with your healthcare professional and any pelvic floor specialist. Make sure if you don't have one locally, get one assessed. If you're in the Orange County area, you can always check us out. If you like more of these pelvic floor therapy information and exercises you can do for yourself, please let us know. We have Dr. Huang. She's a great specialist, and she's always telling me how to make things better for our population and how to get things better. So let us know. Leave that feedback below. If you gave this exercise a shot and it helped, also leave those comments below. And if you like the video, please do this and share it with friends that you may know who need the help. And if we enjoyed your subscription, we're always pumping out cool stuff weekly. If you haven't subscribed, also please subscribe below. I'm Dr. Lin. Remember, we heal smarter, not harder.